families, and supporters. We are so glad you are joining us for today's session on health, wellness, and safety at Stony Brook University. During the session, we have representation from Student Health Services, the Center for Prevention and Outreach, Counseling and Psychological Services, the University Police Department, Student Conduct and Community Standards, and the Student Support Team. To start off this session, we will hear a little bit from each of our panelists, and then from there, we will open the floor for your questions. We also have some PALs or peer assistant leaders who are here to talk about their experiences from a student perspective, so please feel free to ask some questions as well. This session is being recorded, and access to the recording will be available on the same page that you logged into. So please feel free to submit your questions throughout the session, and we will get to answer as many questions as we can. So I'd like to first pass it off to Marissa to introduce herself in her office.
Hi, everyone. My name is Marissa Bisiani. I'm the Assistant Vice President for Student Health, Wellness, and Prevention Services. I'm going to be talking to you today about Student Health Services and COVID-19 for fall 2022, what to do, what to prepare. And while I do that, I'm just going to pull up a couple of slides. Can everyone see my screen? Thank you. Let me just slideshow from the beginning. Okay, I think that's going to work from the beginning. Okay, here we go. So these are some of the areas that are under my purview as the Assistant Vice President. Today, we're going to have representation from CPO and CAPS, but I'm going to talk about Student Health Services and speak briefly about Recreation and Wellness and SASE, which is our Student Accessibility Support Center. So these are actually all the resources. There's probably even more that maybe I did not put on this list, but we are here on this call, just a little sliver or snippet of the areas that support you when you join Stony Brook University. This is a list of many, many departments across our campus that will be supporting you in one way or another. So talking about Student Health Services, we provide primary care services by nurse practitioners, physician assistant, college physicians, and also registered nurses, medical assistants. We have lab technologists. They treat acute and chronic diseases, communicable diseases, disease prevention, travel medicine. We have a full laboratory. We're able to draw blood. We have a pharmacy. We are able to dispense over-the-counter medication and prescription medication that our providers dispense, or if you have an external provider that gives you a prescription, you could fill it at our pharmacy, just as you would do at any CVS or any local retail pharmacy. Immunizations, we provide immunizations around year-round, including influenza and COVID-19, and we will talk about the COVID-19 vaccine requirement shortly. Student Health Services is actually co-located with our counseling and psychological services at 1 Stadium Road. And here is just some brief information. If you want to take a little picture of that, that would be helpful. Just some information about some important phone numbers that you should know. So we are very, very excited to introduce this new service to Stony Brook. This is called Timely Care, and it's virtual care for all Seawolves. So we have our counseling services, we have our student health services, like I said, and we're co-located at 1 Stadium Road. We are not open in the late evening hours or Saturday or Sunday where you may need assistance. So this is an actual virtual telehealth platform that can provide 24/7 medical and counseling support with diverse providers around the clock. It's a call-in on demand, and it can also give you scheduling counseling visits. This is the first year we are launching this service, and we are very, very excited. So you're actually the first group that's hearing about this service. Again, 24/7 care. You can schedule a scheduled counseling visit. Each student is able to have about 12 counseling visits a year. And this is in addition to what Julian's going to be talking to about our in-person counseling services. In addition to our medical, this is in addition to our on-site lab, pharmacy, and everything I'm talking to about you today. If you're not feeling well, if you decide that you sprained your ankle and you can't make it to the 1 Stadium Road building, or if you have any type of disability that you're not able to make it, or any situation, if you're an athlete and you have a real important game and you just are finding these time constraints or you're traveling, you are able to call in to these licensed providers 24/7. They can treat simple medical problems and even prescribe medication. And also there's health coaching services that are available 24/7. And this is with a health coach or a registered dietitian, and they'll talk to you about sleeping habits and really just good life habits or anything that you want to discuss that if you're having any concerns about. So we're really excited to be bringing this as a complement to our services this year. And there'll be more information as you join on to the campus about how to access these services. So this page, I say, just take a picture. Lots of information. These are your general vaccine requirements to be a Stony Brook student. And essentially what the screen tells you is you need your measles, mumps, rubella, you need your meningitis requirement, and you need a COVID vaccine. We do not accept faxes. Everything must be uploaded by our Wolfie Health portal, and all information is sent to the portal that you will have access to with your net ID. So again, we don't take fax. And if you have any questions or concerns, we have an email called vaccinations@stonybrook.edu, and you can email us, and we actually return your email within, most times, 5 hours, but definitely within 24. So COVID. So the most important message I want to share about COVID is that we're here for you. COVID is always changing. I think it's been a really challenging 2 years, and there's been a lot of ups and downs. So really what I'm going to be here to talk to you about today is what to expect in fall of 2022. Not really where we've been for the last 2 years. So we have a COVID dashboard, and that could be seen with all our testing, what our current infection rate is. And Stony Brook has historically had a very, very low infection rate. If you do get sick, even if it's not COVID and it's general influenza, we ask do not go to classes. Do not transmit this to your friends or faculty or anyone that you know. Call our COVID response team, and I will give you information on what to do very shortly. So COVID vaccine. A lot of questions I get is, do I have to be vaccinated? Do I need a booster? The answer is that all SUNY students are required to be fully vaccinated. Fully vaccinated is dose 1 and 2 of an mRNA vaccine. The 1 dose of J&J Janssen is not recommended for this age group. So the vaccine that's recommended from the CDC, and you can go online and look at that information, is Pfizer or Moderna. And you do need 2 full doses to be considered fully vaccinated, and that would be allowed. The only exception is if you have a medical or religious exemption, or if you are a 100% online student. In that case, you sign an attestation that you will not be doing any work on campus, you are not an employee on campus, and you are not attending any in-person classes. So we do vaccinate for COVID on campus. You can receive a vaccine anywhere at any local retail pharmacy. I know that some local practitioners are giving out the COVID vaccine as well. I urge you to think about it this summer, because the goal is that I find most college age students have gotten 1 dose and maybe did not get their 2nd dose. This is the time to get your 2nd dose. Or if you haven't gotten vaccinated, this is the time to get your 1st and then your 2nd dose so that you're fully vaccinated when you start classes. There is a risk to being deregistered or not even being able to register. I should correct myself. You won't be able to register for classes if you are not fully vaccinated. So it's very, very, very important to do this and take care of this business before you start fall 2022. So before you arrive, what is it that you need to be concerned about? You actually need to get tested for COVID 3 days before you either move in or start classes. You can do an antigen test. You could take a PCR test. It's really up to you. If you do a home test, you just have to take a picture of it with an ID and upload it to the portal where you put in all your general vaccine requirements. And if you're going to do a home test, we say try to do it a little bit earlier than the 3 days, maybe do it the day or day of or day before arrival. That would be the best thing to do. We are not going to be collecting it if you plan to live on campus. You'll just be showing it to a representative of residence life or student health services. If you've been positive in the past, you cannot come to campus with symptoms. You had to have completed your entire 5 or 10, depending on your symptoms, isolation period. There is an attestation form on the New York Forward website. There is a link here, and if you need information afterwards, all you need to do is visit, like I said, Vaccinations at SBU, and we will send you that link to the attestation, and you could bring that, and that will demonstrate that you've had COVID within the last 90 days, you have completed your isolation period, and you don't need a test. Okay, we got stuck. Oh, there we go. Excuse me. For ongoing testing after you arrive, all unvaccinated students that have a medical or religious exemption will be required to test once a week. And anyone who is fully vaccinated currently is not required to test ongoing. That could change depending if there is a new variant that hits, like we had Omicron that we did not expect. But if something changes, this is always up for change. But right now, as we're entering fall 2022, fully vaccinated students that do not have an exemption are not required to test regularly. If you test positive, what do you do? Or if you're sick, again, you don't go to class, you contact the COVID response team. You do have to fulfill an isolation period, which I will talk to you shortly about, but you can do that at home. We do encourage students to go home if they are positive or stay with a friend. You can isolate in your room, in your residence hall, and we would give you instructions and guidance on how to do that safely. But again, going home is strongly recommended. So we tell all students before they actually come to live on campus to actually make a plan for being positive. So if you were to turn positive and you were to be sick, obviously the first thing our COVID response team would be saying to you is, what is your plan to go home and recover? We also tell you to contact the student support team, which Ellen on our call today will be talking to you about. They are wonderful. They will talk with your faculty. They will help you. So because it's obviously we're telling you not to go to class and there's going to be some stress and anxiety about that. So they'll help you through that and they'll help you have those conversations and how to have them with your faculty. Some of the COVID symptoms, I think we're pretty much all pros on this, sore throat, cough, fever. There are some strange symptoms. You could have diarrhea or nausea. The most common thing I hear is people think it's allergies and then they're just not getting better and then they test. We do encourage testing because even, what you think is not COVID, you could be. And again, we have our COVID response team that is answering these calls and they're looking at these calls that are coming in 7 days a week. Facial coverings. This is a change. So you are no longer, or students are no longer required on West Campus, and we do have an East and a West Campus, and West Campus is strongly our I would say our typical academic centers, and our East Campus is our health science area. And those are our clinical students who are having some face-to-face interaction with hands-on care with clinical interaction in patients. Those areas are required to still wear a facial covering, even on site or in a classroom. But on the West Campus, there are no facial coverings that are required at this time. And again, everything I'm telling you about COVID is subject to change. So here's some quick common questions, FAQs, and then I'll be able to hand this off to my colleagues because I probably went over my time limit. What should I do if I test positive for COVID and I live in a residence hall? If you receive a positive, I think I've said this multiple times, call the COVID response team. This information is on our website. It's on this PowerPoint. It's really plastered wherever you can see it. If you put in SBU, you could Google that, SBU SHS, and you'll find it right on our website on the Google. Leave a message. We will call you back. We want to know about your positive test result and what to do. Even if you've been exposed, and you want to know what to do, or you have a friend or someone that, let's say, who's vulnerable, who's at high risk for advanced illness, we can help you through those concerns. And again, we answer these calls up to 7 days a week. Can I attend class or activities if I test positive? You cannot attend classes or activities or finals with or without symptoms. Some people turn positive and they don't even have symptoms. No, you cannot attend class because you are contagious. So we ask that you don't have guests in your residence hall. And again, we ask that you contact the student support team to have that coordination with your faculty. And if you need that assistance. And again, everyone, according to New York State, is required to isolate for a minimum of 5 days. And that shortened isolation period can be done safely in your residence hall. Can I isolate in my room, or must I be relocated to another room or leave campus? When COVID first hit, many students and institutions were relocating students to other residence halls and having them to stay alone for up to close to 10 days. And we recognize that this is not good for, I would say, students' mental health, well-being. We really have moved to more of thinking about COVID in more of an endemic phase, where we're trying to think about, this is going to be with us for quite some time, just as influenza is. And we're going to help our students work through being sick and how to really get through those 5 days with not having to be completely isolated or uproot them from their res hall. So yes, you can stay on campus. You could stay in your res hall, but again, we do encourage you to go home. We do encourage you, if you want to stay with a friend, we would talk to you about how to have conversations with your roommates and how to tell them, but we do ask that everyone in the room does wear a facial covering during that time, up to a full 10 days. How do you isolate? I think I said a lot of this information already. I'm not going to really repeat it because I know that I've gone over my time limit. But the most important thing I want to tell everyone is really it's important not to share personal items. I hear so many times I accidentally used my roommate's toothbrush, and I know that doesn't sound really good, but I've heard that. Shared a cup. If you have an intimate partner that is sick, now is not the time to spend time with them. Really try to make good decisions and be aware of your surroundings. And that's the best way that you can stay healthy. And if you do need to isolate in place, we have many opportunities to use a grab and go food service. So you can obtain your food, bring it back to your res hall and eat. So you will still be able to use your meal plan or any other arrangements you have for food. Other campus resources, really brief, we have our student recreation and wellness. I just want to identify that this is our state-of-the-art gym. We have wellness, intramural sports. We have a massage chair, a dietitian, but we also have chiropractic services there. So it's really something to go visit if once you get on campus. And we also offer off-campus trips, so visit their website. We collaborate with Campus Life in terms of doing trips to Broadway, trips to Great Adventure, a lot of the fun things that occur in college. So definitely something to look at. This is just a glimpse at our summer fitness schedule, and you can see that we're just year-round and doing some things. And even though our campus is less occupied in the summer, there's something for everyone. This is Rec on the Go. It's an app that you could download right to your phone with all the activities that I just talked to you about and how you could schedule them. Really briefly, I just want to talk about Student Accessibility Support Center. They are located in the Student Union, room 107. This is where if you have any accommodations that need to be put in place for your testing environment or anything in the classroom, if you need a certain chair or if you need any type of assistance or a note reader, any type of, I would say, ability that you need assistance with, this is the place to go to and register with. And I'm done. Again, I didn't look at the clock, but I know I probably went over. So I'll save my questions for the end. And Lexi, thank you for your patience.
Yeah, no worries. Thank you so much, Marissa. I'd next like to pass it to Adam.
Sorry about that. 1 second, I'm going to share my screen for everyone to see. All right. Hello, everyone. Thanks for having me here today. I hope you learned some great information from Marissa on student health services. I'm here to talk to you a little bit about student conduct and community standards at Stony Brook. First, a quick who's who of who's in our office. Myself, obviously. My name is Adam Furtman. I'm the Director of Student Conduct and Community Standards. We have a small but mighty team of 4 in our office. Sandy Mong is our Associate Director, Dee Phillips, our Assistant Director, and Christine Vero is our Staff Assistant. We're located in the Stony Brook Union, Suite 209, and obviously you can see our email address. That is one of the best ways to contact us, and we do get back to students as soon as possible. This is our mission statement. We really, one of the things that we pride ourselves on in student conduct and community standards is that we are an educationally focused office. When you come to our office, you are not treated as a criminal or someone who is bad or has done something wrong. We're here to help students learn and grow from choices that they make and from experiences that they have on and off campus. And that really is the main focus and mission of our office. Much like our friends in student health services, we do have links to virtually every corner of the campus, as you can see on this model. So when you work with us, please know that you have access to a full complement of resources, and we'll be able to help you get connected to other partners in other offices should the need arise. This is one of the most important documents that you'll need as a Stony Brook student. It's our Code of Student Responsibility. It's available on our website, which you can see down below. But really what this is all of our policies, procedures, and expectations that we have for all Stony Brook students. As I said, it applies to all students, and it really guides our practice in how we address student conduct issues on our campus. Some key policies that I really want to highlight for us today. First is our alcohol and drug policy. We obviously do have policies around alcohol and drugs, which is important for everyone to know and understand. Much like the world outside of our campus, if you are under 21 years old, you cannot use alcohol on our campus. Drugs, specifically, I want to highlight our marijuana policy, because I know in New York State, marijuana has become legalized. In many other states, it has as well. Please understand, however, on our campus, marijuana still is a banned substance. The main reason for that, which some people don't actually know, is we are bound by federal law. And federal law has not changed regarding marijuana or other drugs. And in order to keep the federal funding that we receive as a public university, we need to be abiding by all federal laws. So until the marijuana laws are changed for the entire country at the federal level, we will still be abiding by those laws, which means that marijuana is prohibited on our campus. Our Good Samaritan policy is another really important policy to know. This protects our students who are seeking help for a friend or classmate who is having a medical related emergency due to alcohol or substance use. It's really important. We never want someone to feel like they can't call for help for fear of getting in trouble for something. So we have a Good Samaritan policy in place that basically says, if you're reaching out for assistance for a friend or even for yourself, you will not be subject to our conduct process for an alcohol or drug policy violation. We still will talk to you, have a conversation with you, and provide some educational resources for you around that issue, but it would not lead to a student conduct finding of being responsible for a violation of policy. So that's really important. Our tobacco-free university policy is one that I believe strongly in, and as does just about everyone at Stony Brook. What this means is tobacco products are prohibited on the entirety of our campus. You cannot smoke on our campus. And it is something that we all take seriously. And it's something that every member of our community is expected to assist in the enforcement of. We can't possibly have someone at every building around campus, making sure that no one's smoking. So it's really up to all of us to keep each other accountable for that and remind one another that tobacco products and smoking is prohibited on our campus. Finally, I want to mention our sexual misconduct and Title IX grievance policies. These are not policies that we celebrate on our campus, but they are so critically important to protect the safety of every student on our campus. We go into detail in them in the Code of Student Responsibility. So I really want to make sure that you do take the time to read through those policies and understand them. There's going to be some great resources through our orientation program when you come to campus in August. Our friends in the Center for Prevention and Outreach do a great job of educating our community on that as well. So please make sure you're being mindful of those policies and you're really reading into them. And if you do have questions around it, please be sure to ask those questions before it becomes an issue. We want to make sure that our campus really is safe and secure for every single person. A couple of things about our process and policies, and this is a question that we often get. When when something happens, when a policy is violated, who takes care of it? Does it all go to student conduct and community standards? Do other people handle it? So basically what I wanted to illustrate here is that there's multiple jurisdictions, there's multiple offices that might be reaching out to our students regarding the student conduct related issue. The vast majority of incidents that occur in the residence halls are handled by our colleagues and campus residents. And again, we work very closely with them, following the same process and similar mission, so on and so forth. You obviously have my office, student conduct and community standards. We will handle any incidents that occur outside of the residence halls, off campus, and really any incident that could involve more extreme penalties involving suspension or expulsion from the university. We have our Title IX grievance process and our sexual misconduct process, which again, as I mentioned before, really important policies that are sort of handled slightly differently than our regular student conduct cases. Clubs and organizations are also subject to student conduct policies. Our friends in student engagement and activities oversee conduct for groups and organizations. We, again, work very closely with them in case there are links in their individual cases that we need to handle as a result. And then academic misconduct. Academic misconduct and academic integrity are not handled by my office. They are handled by our partners in academic affairs. Again, that's sort of detailed in the code as far as who you would be able to reach out to if you have questions about that as well. Okay. We resolve cases in a whole bunch of different ways, from informal resolutions. What informal resolutions could be, they could be a conversation. Maybe it's maybe it's sort of on the borderline. Maybe it's not a policy violation, but it's something that we still want to have a conversation about and educate you on. So we might call you in for a meeting to have a conversation about an incident that occurred. Student conduct meetings are one-on-one meetings between a student and one of our staff members, and the cases are typically resolved within that meeting. Student conduct hearings, along with our Title IX and sexual misconduct process, are handled by a panel of staff members that will review the facts of the case, will ask questions, and then will ultimately render a decision in those cases. And then, as I mentioned, our academic misconduct cases are managed by our colleagues in academic affairs. A couple of programs and services that my office will offer throughout the year. We will be participating in the Choose Your Own orientation sessions. So we have a couple of great sessions on conflict management, on decision making that will really hopefully set you up to be successful Seawolves here. We are always soliciting student board members for our administrative hearing boards. Yes, that's right. You can serve on a hearing board to help resolve some of our conduct-related issues on campus. I think it's one of the greatest leadership opportunities you can take on, because you are helping enforce our policies. You're helping hold people accountable and really treat them fairly through our process to ensure that we do have a safe and secure campus. We offer a number of educational programs that will be publicized throughout the year. Some of these are offered to club and organizations to help them learn and grow. Others are offered to our student population in general, so be on the lookout for those. And then student conduct certifications. Our office will get involved and assist for students that are applying to graduate or professional schools, who are applying for study abroad, and who might need background checks for employment opportunities. Sometimes that's even on campus, or for security clearance if they're going for, we do security clearances for the NSA and for the FBI for students that are applying for jobs in those areas. So you might interact with our office in a number of different ways. So for our family or supporters that are participating today, I have a slide specifically for you, because one of the great questions we always get is, how can I help? And we want you to help. We want you to be a part of our process. There's a couple of things that are important to understand, though. There is a federal law in place called the Federal Education Rights and Privacy Act. Many of you are familiar with it. It's called FERPA. But basically what that means is, once a student turns 18, they are now in control of their academic records and their educational records. We need to abide by that. So unless your student signs a release with our office saying that we can communicate certain pieces of information to you, we might not be able to share that specific. With that being said, we can always talk to you about what our process is, what the process looks like in more generalities, but might not be able to share specifics with you about a specific case. That also means that if you have concerns about maybe your son, your child's roommate, we would definitely not be able to disclose that information to you, because that is their protected information as well. How you can support your student is by understanding our process. We would ask you to also read our code of student responsibility and have a good understanding of it. Encourage them to ask questions. One of the things that we are always doing with our students is really saying, do you have any questions? Do you understand this? Because we don't want someone going through a process that they don't understand. So really encourage them to ask those questions and seek guidance and support when they need it. How you can support us and help my office: encourage honesty and accountability. That is one of the biggest lessons that people can learn through the college experience. Owning when you've made a mistake. I guarantee the vast majority of mistakes that students make on our campus will not suspend or expel them from our campus. And it will be a great opportunity for them to learn from this experience. Encourage attendance at meetings. Avoiding a conduct meeting does not mean that it will go away. It will happen in your absence, and then you don't have an opportunity to participate in the process. So really encourage your student to be an active participant in our process. And then finally, what I would say is trust the process. We are professionals. We're not here to be judgmental and to cast judgments on your student. We're here to really help them learn and grow through this experience and this process. So trust and know that our role is to protect them and to protect our campus community as a whole and make it a really positive student experience for everyone. So this is our contact information and our website, which has a lot of great information on it as well. We'll obviously be on at the end to answer some more questions as we wrap up. But thank you so much for your time. And I will turn it over to the next presenter.
Hi there. Hi, everybody. My name is Chris Saris. I'm with the Center for Prevention and Outreach. I'm just pulling up my slides, if you bear with me just a moment. And we're going to keep this relatively short and sweet. What I think is most important for everybody to know is that CPO is another department under Dr. Bisiani's oversight, part of student health, wellness, and prevention services. But what CPO focuses on is education and outreach, as well as some early intervention services to help students kind of gain more insight and learn more about various health and wellness related things that could impact their experience as undergraduates or in other parts of their lives, to help students use that knowledge effectively to take care of themselves and others, and also to help people connect with the resources and the skills and the strategies they'll need to continue to take care of themselves. So that's why you've heard a few times people highlighting how the folks in my area are connected with lots of different people, just as Adam was just kind of communicating a few minutes ago. And so this is what really underscores like our little slogan, which is educate, empower, and connect. We really want to help all of you kind of feel like you have what you need to deal with any challenges that might come along, that you might face as part of your undergraduate or your graduate or any part of your life experience, right? But especially talking about here at Stony Brook. So I want to just briefly go over some of what we deal with and focus on. And you can always ask a little bit more before we wrap up if you have additional questions. Broadly speaking, CPO focuses on 4 big topics. The first is alcohol and other drugs. So again, the focus is on prevention and education with an emphasis on preventing things like overdose, right? Another big area is mental health awareness and suicide prevention. So when we're talking about mental health awareness, we're both talking about awareness around what makes us healthy, what does not being so healthy look like in that area, and where can you go to get more support, or what can you do to kind of better cope, take care of yourself with what you might be dealing with. Violence prevention, education, advocacy, bystander intervention, and healthy relationships programming. That's another big topic. That's why you heard it kind of come up a few times when Adam was speaking, because of the overlap with sexual violence there. This is actually my area, one of my areas that I focus on at CPO. We put a lot of energy in helping students understand, what are we talking about when we talk about sexual violence? What does it look like? What is the experience like? What are those impacts like? But also, what is healthy all about, right? What makes a relationship healthy, and what are some of the skills that people can develop to kind of create and maintain healthy relationships throughout their life? And finally, another really big important topic, physical health and wellness. So collectively, we're covering a lot of the big dimensions of wellness in any individual's life, as well as any community's life. And you're going to find lots of different kinds of programming on each of these topics. Things ranging from workshops help you learn a little bit more, outreach activities like healing arts or the wellness bar to help you connect with your peers and maybe in a lighter, more fun way, learn a little bit more and gain some skills and some connections. But we also offer a whole bunch of other things to support you in these areas. Chief among that, free health products, lots of different free health products. So condoms and other safer sex products, menstrual hygiene products, flu prevention, first aid kits. These things are all available free from CPO because we really do abide by the old proverb, right? An ounce of prevention is worth a pound of cure. So we want you to come, we want you to reach out. You can always stop by the office as a student to pick these things up, but you can also kind of make the request and have a little like package of goodies waiting for you. Either way, we do hope you'll get used to visiting us at CPO. We're in 108 of the Union, but you can also see we've got the link there for putting in your request so you can just make your request. For those of you who might go on to other roles on campus, like maybe being an orientation leader or being a resident assistant. These are the kinds of things we want you to spread the word about to, other peers and students that you might be connecting with. Right now, tell your roommates, right? But don't be shy. Do come out. We also keep a cart outside of our office. So people who maybe are feeling a little shy and don't necessarily want to say, hey, I'm looking for this or that, can still access some of the stuff that we make available. We also offer a wide variety of training opportunities. I've emphasized this idea of, taking care of ourselves, but also taking care of other people. That's a big value at Stony Brook, this idea of looking out for each other, taking care of each other. Seawolves step up to look out for other students. That's a value that you're going to hear and see kind of emphasized in a lot of different ways. And we want you on the topics that we're dealing with to really have a place to go to learn more, to practice those skills that in a really key moment when every minute really does matter, you'll be able to help. Our 3 big bystander intervention training programs focus on a couple of those areas I mentioned before. Red Watch Band, that's the first one you'll see on the slide. That's all about helping people recognize the signs of an alcohol overdose, a potential alcohol overdose, practicing a little bit to kind of think about, well, what would I do in that situation if I saw those signs? Talk about some of the obstacles that might be in place for doing anything in the first place, and also identify the resources. For example, and you're going to hear from our friends in the university police, I believe, before we were today. But one of the things that's going to be interesting to know is that we have multiple ways to contact our university police department. 911 from a campus phone, but from your cell phone, you're not going to call 911. You'll get somebody in Suffolk County. We get more into that in Red Watchman. I'm not going to go too far into that tangent because, again, we have some of our friends from UPD here today. Same thing goes for QPR, this idea of learning what to look for and how you can access some help for you or for the person that you're concerned about. And that's QPR, which is short for question, persuade, refer. And it's all about helping people who may be recognizing the signs that a good friend or somebody else that they care about are overwhelmed, depressed, possibly thinking about suicide. How do you approach them? How do you show you care without kind of creating defensiveness? And that's a big focus of that program. Green Dot, that is all about interpersonal violence prevention. So again, what does it look like? How can you recognize it if it's happening like across the room or across the campus? What can you do to make a difference? Either to intervene in a way that can hopefully prevent violence from happening, or to support somebody who may have already experienced violence long before you ever encountered them. We offer a variety of additional workshops and trainings, but these are our big 3. And one of the things that you'll learn more about, like in your 101 classes and other kind of stuff that you'll be doing over your first couple of weeks and months, is that we offer students a special award when they complete all 3 of these. So if you complete all 3 of these trainings over the course of your undergraduate career, that's about 6 hours out of your total 4 years, you get a special certificate, you're invited to a special gala event, and you also get a special cord, an honor, a recognition to wear during your graduation ceremony. So we want you to know about this early. There's lots of more ways to get involved, but this is one we definitely want to see everybody participating in. Beyond kind of these formal training and skill building opportunities, there's also lots of ways for students to get involved to be the person that other people might come to learn from. We have a variety of peer education opportunities, and they're all built around helping students learn more about these topics so that they can help educate their peers. So we have specific tracks in each of these areas, as we mentioned, the physical health, the mental health, the substance side of things, as well as the healthy relationships. We also have another peer education track that's focused on what we call our meaningful fun initiatives. That's our healing arts programs and other things that really focus on self-care and finding creative ways to help us all take better care of ourselves in meaningful ways. We have so much more than what I'm covering here, but I do want you to kind of just remember there's really something for everybody. So whether you're looking to learn more and just kind of add to your own knowledge or looking to learn more so that you can support others, these are all great options. And I hope that you'll reach out. Now we're gonna wrap up here in just a minute. I intended to keep it short and sweet, but it's very hard for me not to get excited about the stuff we do at CPO. Before we wrap up though, I want to make sure you know about a key resource that is located within my office. Our Survivor Advocate and Prevention Specialist services, again, they're part of CPO, but they're available to everyone. Our Survivor Advocate works closely with a number of different departments to be sure that students who have experienced any form of sexual violence during their college experience have the support they need. So this is a campus-based resource, right? So this is somebody who, if you experience anything in relation to your Stony Brook experience, they're going to be able to direct you to the right resources. And when I say the resources that are right for you based on what you've experienced and what kind of help you might need. This is a confidential resource. And really one of the most common things students will reach out for is just say, hey, this is what happened. This is what I experienced. What are my options? Or even the idea like, does this count? Does this count as violence? And whether it's something that kind of counts by a specific definition or doesn't, we're still going to be there to kind of help connect you with whatever you'll need to take care of yourself. And we have a number where you can reach somebody during the day. You'll get the live person. During the evening and weekends, we also have a service to make sure nobody is ever reaching out for help and kind of left dangling there. So you can reach out anytime. You'll be connected, either with somebody who can say, okay, for the short term, we've got your information and we'll connect you on the next morning. Or if it's an emergency, for example, a situation where someone needs to use the sexual assault nurse examiner or the SANE Center, which is essentially, for those of you who've ever seen like Law and Order or something like that, it's where the forensic examination is done, what's commonly referred to as the rape kit. That's a situation we're not going to leave a student kind of left to their own devices. We're going to be there for you, as will my colleagues in other areas like UPD, if the student is looking for that level of support. But again, there's more to what we offer in this area. I'm going to be hanging on till the end of the call. So anybody who has questions, you can just grab me. But for right now, I just want to thank you for the time today. I'm going to take myself off the share and turn it over to our next presenter, which I believe is Ellen.
Thanks, Christine. Hi, everyone. Welcome. Congratulations. You're Seawolves. You're part of this amazing family that we have here. And we're student support. That's it in a nutshell. You need support. We will help you. And the reason that we have student support with all these amazing resources on campus is because when we're under stress, we get all confused. What we do is we talk to students and families and say, what do you need? How can we help you? We would like to do some problem solving and get you to the right place within a short amount of time. Some of our colleagues across the country, we've heard students say like, I went to one office, they sent me to another office, they sent me to another office. Probably about 10 years ago, Stony Brook students said, we don't want to do that anymore. And the student support team was born right out of the Dean of Students office. So we have a little bit of a connection with all the other offices on campus. So that's pretty much what we're here for. We work for you, students. We work here for your families too, but in a different kind of way. If a family checks in, they're worried about you, we'll listen to everything they have to say and we'll say, all right, we'll get back to you. Not really. What we do is we go over to the students and say, your mom is looking for you. Would you call her, please? And we open up that line of communications. Oftentimes students have lost their charger for their phone. That's why they lost contact. We have very few major emergencies. So mostly what we do is we just work with students to see what they need. Maybe it's a financial crisis. We have an emergency fund if that's what happens. Maybe it's a family crisis at home. You need to go home for something. Your grandmother gets ill. We will connect with your faculty members when there's those kind of absences over long term, and we'll really help to get you to the places you need to be. So it's a lot. You focus on your academics, and if the world starts kind of getting heavy and confusing for you, you can come to us. I can pass you to my friend Julian and CAPS, or Christine and CPO. There's so many great resources around here. So please, if you're thinking I don't know what to do, but I just need support, we actually named our department after that need. So we are student support. You can find us on all the resource handouts that you're going to get. And please just come, we'll have a cup of coffee together. There's no question too small and no issue that we haven't already covered before. So welcome, congratulations, and we're on your team, student support team.
I think I'm next. Thank you, Ellen. My name is Julian. I am the Director of Counseling and Psychological Services, and I am going to bring up a couple of slides. Here we go. Welcome, everyone. This might feel like a little bit early in the summer to start talking about the specifics of the mental health services we offer, but as we'll see, I don't think it is too early. I think now is the perfect time to know that Counseling and Psychological Services, which you will come to know as CAPS, offers completely free and confidential mental health services and a complete range of those services, individual and group therapy, workshops that we offer to the community, as well as psychiatry and medication management, if that is a fit. One of the good things, and there are a few good things that have come out of everything we've been through with COVID, is that we really expanded how students can access us. So there are so many choices depending on what you need in terms of mental health support to access. So we expanded into telehealth during the pandemic, and now as we are hopefully coming out of it, we are going to permanently have a hybrid model where if an in-person face-to-face counselor is what you prefer, we have that. And we also have a wide range of telecounseling options that includes what Marissa was referring to earlier, that about timely care. So Monday through Friday, 9 a.m. to 5 p.m., CAPS is open, offering both in-person and telecounseling sessions, and timely care, which is coming on board, means that there is also counseling support, including regular ongoing counseling up to 12 sessions that offers evening and weekend hours. So when you arrive on campus in the fall, you are going to be getting so much specific information about how to access these different forms of care. But here at CAPS, we really are the place, if it's ever like, I know I'm having some kind of mental health difficulty, I'm not sure what would be best. That is what we're here for. Don't feel like you have to figure out exactly what you need. All you need to know is that you want to speak to a counselor, and we at CAPS are the place to call or go on our website to schedule an initial consultation. That is how it all gets started. We don't assume what you want until we've spoken to you. When you call us or go on our website to schedule an initial consultation, your first point of contact will be a 20 to 30 minute conversation with one of our counselors that goes in depth about what you are looking for and what the different options are for what you're struggling with. And it's at that point that if ongoing counseling is what's best for you, that we will get you set up with a counselor that you could meet with on an ongoing basis. But we first like to take 20 to 30 minutes. All you need to know before you contact us is I'm struggling with something, and then we will help you figure out the options, whether that is with us, whether that is with another one of the resources in the community. whether it's all of the above. Your job is to know if you're struggling, to go to our website and schedule an initial consultation, or to call us at the number listed here, 631-632-6720. Some people love going on the website and being able to pick their time that they're going to have that first conversation with a counselor. Other folks want to do it the old-fashioned way and call us on the phone. We are happy with either. The main thing is sometimes folks go on the website, see times available, don't see a time that fits. The main thing is to know that doesn't mean we don't have a time for you. That means you just need to call us and we will set up a time for you. But again, when you call us, we will make sure whatever the struggle you're having is to talk to you about the whole range of options and get you set up for that. When we are closed, as I said, Monday through Friday, 9 a.m. to 5 p.m., we are open. As soon as we close, our same phone number goes to our after hours line, which means 24 hours a day, 7 days a week, there is a counselor to speak to about whatever is going on. These services, I think they're just terrific and they're really customized. Some folks come in with some preconception of what mental health services are based on hearing what someone else's experiences are, like, oh, if you go to a counselor, you have to commit to seeing them weekly, or this sort of thing. That is not how we operate. We design a plan for every student based on their unique situation. And so that's why when you arrive, we just want you to call us. The reason why I think this is a great time here in June to start thinking about mental health services is because of how much telecounseling is available nationally. More than ever, students and families are going to face complicated decisions about when you go off to school, do you leave a therapist that you might have and be comfortable with at home? And that is not our decision to make for you, but it is one that makes it a really good idea to get in touch with us this summer. If you are planning your students' mental health care for the coming year, we really encourage you to call us and we will talk through the pros and cons of staying with an existing provider at home through telehealth, which can be a really good idea because a therapist who's been working with your student may know your student best. But we'll talk through all of those pros and cons to make a decision about what the best mental health care plan is as your student joins us here at Stony Brook. And that's all. Thank you very much. To UPD.
All right, I think I'm bringing up the rear, closing it out. My name is Jared. I'm with UPD. I'm a police officer here. I don't think I'm having enough time, so I'm going to give you just a few phone numbers on ways to contact us. If you're on campus, 333 from any campus phone, 631-632-333. Very important to contact us. That's from your cell phone. If you dial 911, you're going to get the police that are in your area, and they're going to tell you to hang up and dial us. So again, from your cell phone, 631-632-3333. Very important. Another way for students to contact us, something cool here called the SB Guardian app. It's a free app that if you have an iPhone or an Android phone, it's in your app store under Rave Guardian, R-A-V-E Guardian. It's a free download. We encourage you to download it. What you do is you download the app, set up a profile page, put your picture there, class schedule, any information that you would want the police to know if they're responding to an incident involving you. So the way this app works is, let's say you're walking home on campus late one night, someone's following you, you get a bit nervous. Reach for your phone, but you don't have our number saved in your phone. That's okay. As long as you have this app on your phone, you can open up the app and then press the emergency button on that app. Once you press that emergency button, that phone call goes into our police dispatcher. On our dispatcher's phone display is the exact location of where you are and who you are. That profile page pops up, so we know who you are by your picture. We have all the information that you have provided us. The app is GPS enabled, so a map of campus pops up as well on our computer, and you become a blinking blue dot on the map of campus. So we know exactly where you are. And we send all police officers to that blinking blue dot. Let's say worst case scenario, someone grabs you, puts you into their car and drives you off campus. As long as you press that emergency button, we'll follow that blinking blue car anywhere it goes and be able to retrieve you and get you back safe and sound. So those are just some of the ways that you can contact UPD. I think that is my time. I wish I had more time, but that's it. And just welcome to Stony Brook.
All right, thank you, Jared. Thank you to all of our presenters. We do have some time to answer any questions. If you want to submit your questions in the chat, we have just a few minutes left. Jared, can you just repeat the name of the app again? Oh, you're muted. Jared, you're muted.
It's called Rave Guardian, RAVE Guardian. It's in the App Store. It's a free download. The symbol is a blue and white shield.
Thank you.
You're welcome.
Do we have any additional questions? For my pals that are on the call, is there anything you'd like to add in? Those that are asking for a summary of today's presentation, we'll have this posted on our YouTube page, ideally by the end of this week. We have a question about student loans. So we have a session coming up on paying for college on July 6th from 5 to 6 p.m. So the same way you signed up and registered for this session, we'll have the same type of setup for the paying for college session. Again, July 6th from 5 to 6 p.m. All right, do we have any additional questions? All right, so, oh, hold on. We have a question regarding a prescription that somebody has. Would you need to contact the student health center?
What is the question? Is they want to fill a prescription?
It's specifically regarding a birth control. They want to know if they need to contact the student health center. That's all they've included so far.
So actually, it's a great question. So we actually dispense birth control. You just have to have a visit with one of our practitioners to have a risk assessment, and we can dispense that. And if you have a prescription for birth control from an external provider, we can also fill that at our pharmacy. Our pharmacy is located on the first floor of One Stadium Road, which is where our student health center is. And you could just come to the building, and at the door, we have a service attendant, and you could just tell them you're here to see the pharmacy and drop off the prescription. And I just want to also share that any co-pays that you are billed through your insurance apply. Obviously, birth control is not something that is a copay, but any other prescriptions, I do want to say that it works just like a regular retail pharmacy. We have very competitive costs. Many times we are compared to, Walmart or, a Costco or any of those, pharmacies that are lower cost.
All right, so that looks like we're coming up on time. I want to thank all of our panelists for joining us today. If you have any questions, you can definitely refer back to this video that'll be on YouTube. You can also email our office at orientationoffice@stonybrook.edu. Many of our partners share their contact information on today's call as well, so feel free to connect with their areas directly and let us know if we can help you in any way. We look forward to seeing you in a few weeks. Thanks, everyone.
Great. Bye.
Bye.